We are Physical Therapy and Balance Centers. I'm Angela Yarborough, and this is Dr. Jerry Yarborough.
Hello.
We're going to continue our discussion today on types of hip pain, and I'm not even going to try to say what we're talking about today. I'm going to hand that over to you.
There's so many different causes of hip pain, and today we're specifically going to be talking about acetabular necrosis. Now, if you remember the anatomy real quick, we have a ball and socket joint for our hip. On the pelvis, you have a acetabular fossa that the head of our femur sits in. There's a number of things that can cause the blood supply to this area to be cut off. And when that happens, that's going to cause acetabular necrosis. The bone's going to die because the blood supply has been cut off. That can be caused from either genetics. It can be caused if you dislocate that hip. It can tear those blood vessels. There's not that many, so when there's damage done to them. It can even be caused from taking prolonged steroids. All that has to be kept in mind. Again, the pain that you're going to experience is going to be a deep growing pain, maybe a buttocks pain, and then even go down your leg. Most of the time, the pain is going to start whenever you stand up on that leg and start to weight bear on it. But eventually, it'll kind of hurt all the time. So we're going to go over some good mobilization or stretches to that joint to help open it up and loosen it up so the blood can flow easier. And then we're going to go over a few stretches. So again, this is Johnny Pye. He's one of our marketers here, and he's going to help me demonstrate the hip mobilization. Now, you can secure a belt or something rigid on a stable surface at home. Put it around your leg like Johnny has it here. And it's got to be real high up to mobilize the hip. So let's go from the front first. This is actually stretching the front of that capsule. So you put it real high, and then you're just shifting your weight back. And that's going to actually mobilize the front part of your hip. And then you can turn sideways. Same thing, make sure it's kept up high, and you're just going to shift your weight to the side. For me, specifically, this one feels really good because you're going to feel a good stretch here on the outside of your hip. And then keep turning, turn that way, and then you're going to shift your weight forward, getting a posterior stretch. Now do all of these about 10 times, or so, and that'll be good, okay? And then after that, we're going to do a few strengthening exercises. And it's what we call the hip three-way, okay? You can do it standing with your hand on a stable surface to make sure you don't fall. So first, we're going to start off with hip flexion. You're going to do it about 10 times starting off, and then hip abduction. There you go, out to the side. Always make sure you're standing nice and tall when you do these. And then kicking straight back. Definitely make sure you're standing tall with this one, okay? All right, you're going to start doing one set of 10, then build your way up to 3 sets of 10 or 15, and then you can even add ankle weights. All right, so those are some good mobilizations and beginning exercises. If this doesn't help you, schedule an appointment with your physical therapist here at Fyzical. We're going to put you through a thorough evaluation and set a specific plan of care to help you overcome your impairments. All right, guys, that's about our discussion today. Thank you. We'll see you next week.